Hello, everybody. I am Wolf Kirsten. Welcome to the webinar, Creating Healthy Workplaces in Africa. And I see people coming in here, slowly rolling in. So welcome, everybody. Good afternoon or good evening. Could be good morning to some of you as well. So thank you so much for joining. We have an exciting webinar planned today. And hopefully we'll get some discussion going with various perspectives from different countries and really focusing on the issues regarding to workplace health in Africa, and that's a big task, as you will agree. So we got some background noise, so if you could please mute yourself. Thank you. So as I said, I'm Wolf Kirsten. I am the co-director of the Global Center for Healthy Workplaces. And the Global Center is also now the home of the International Association for Worksite Health Promotion. And I'll mention a few words a little bit later about the association and the opportunity to potentially play a role for you. So let me kick this webinar off by presenting you, by sharing my screen, 1 second, and just try to give you an overview of, 1 sec, I'll be right there. I hope you can see it now, the presentation. So I'd like to give you an overview of the what a healthy workplace is. And obviously we could talk about this for hours, but I think it's important for you to see, if you're not already seen it, the healthy workplace model, which is from the World Health Organization, developed about 10 years ago, but still very relevant on a global scale. And you'll probably agree that this model is very comprehensive. It has various aspects: physical work environment, psychosocial work environment, personal health resources, and also the role the enterprise plays within the community. And then you'll see a continuous improvement cycle in the middle. And then at the very middle, leadership engagement, worker involvement, so crucial. And then, of course, ethics and values should be the foundation of every organization. So, of course, we could really discuss this, and you'll see this reflected today in our case study. I'm pretty sure, and what it really means to implement such a model within a company within Africa. The Global Healthy Workplace Awards, I know many of you are familiar with them. They are directly aligned to the model and the criteria that you just saw from the World Health Organization. And every year we invite 6 finalists to the Global Summit. As you can see here, it's on November 17 and 18. It's virtual this year again, unfortunately, but we all know the reasons. And you can see below the companies which qualified and from the various applications from different regions. So again, we're very happy to welcome these companies who have done an excellent job in terms of promoting the health of their employees. So please join us. And if you paid attention, you will know that for those of you who officially registered, will be eligible for a complimentary registration to the summit. You just have to send us an email on the email on the right there, info@globalhealthyworkplace.org. So no further ado, I will now pass it on to 1 second here. I need to find my. Okay, so I'll stop sharing. I will pass it on to Aline Ferrand. And Aline is an organizational psychologist from Mozambique, based in Maputo, Mozambique. And I've gotten to know Aline through HERO, the Health Enhancement Research Organization, which is a US-based organization where she interned for a while. And so I'm very glad now that Aline is a member of IAWHP, and I'm very happy for her to moderate today's session and also introduce our case study and our speaker. So I will hand it over to Aline. Thank you.
Thank you very much, Wolf. A very warm welcome from Mozambique to everyone. I'm Adeline, as Wolf mentioned. I'm a Mozambican psychologist, and I'm going to be with you for the case study presentation that we are very excited about today. Before I introduce you to you, our honored guests, let me tell you that you are welcome to send your questions and comments during the presentations on the chat, and we'll be asking them at the end. Now, it's my great pleasure to introduce you to Lillian Okoth. Lillian heads the Human Resources Unit at the African Population and Health Research Center. She's responsible for staffing issues, including talent acquisition, training and development, staff welfare, and retention. She holds an MBA in Human Resources Management, a Bachelor of Education degree, and a postgraduate diploma in Guidance and Counseling. She's currently pursuing a PhD in Leadership and Governance. She's interested in seeing people maximizing their potential and enjoying what they do. And I have no doubts about it. Lillian, the stage is yours.
Thank you. Thank you very much. I'm honored to be here. I will take you through the workplace program for APHRC. Just a moment, please. Aline, can you see my screen?
Not yet, Lillian. Now I can.
All right, thank you. And thank you for the introduction. I work with African Population and Health Research Center, popularly known as APHRC, and this is our—
Lillian, sorry for that.
Yes.
Sorry for interrupting. It is still not in presentation mode. We can see the presentation, but not on slideshow.
I have now put it on.
Okay, it's probably coming. But you can go on, I guess, because we can see it.
Okay. Let me do that again. Sorry.
Meanwhile, let me remind you that you can feel free to send your comments and questions during the presentation, and we'll be asking them at the end. Lillian is about to reshare her presentation so that we can all follow.
Is it on presentation mode now?
Not yet. We can see the presentation again, but not in presentation mode.
Okay, maybe I can just go on. So the vision of APHRC is to transform lives in Africa through research, and our mission is to generate evidence to strengthen research capacity and engage policy to inform action on population health and well-being. APHRC was founded in 1995 as a program of the Population Council, and then we gained independence in 2001. We currently have 172 staff who come from different countries, 12 countries to be precise, and it's a multidisciplinary and multicultural team. In terms of what we do, we conduct research, and then we conduct research, capacity strengthening, and policy engagement and communications. On research, our focus is on 6 areas: aging development, education and youth empowerment, health and systems for health, data measurement and evaluation, population dynamics and reproductive health, and then urbanization and well-being, as well as maternal and child well-being. I will not go into the details. And then for research capacity strengthening, our mandate is to build both individual and institutional research capacity, starting with our own staff and also going out to individuals in other parts of Africa, as well as in those institutions. So, and research capacity strengthening, also known as RCS program, we conduct research on higher education. Then we have partnerships with universities. We have fellowship and internship where we provide like doctoral fellowships, and then we have the training programs. We also have a division that looks at policy engagement and communication issues. It's divided into 3 units. The visibility unit focuses on corporate communications and strategic policy engagement. And then we can see where the 6 research units collaborate and the RCS divisions. And then we have a unit that looks at advocacy issues. These are projects that involve capacity strengthening of CBOs. And we implement our research, RCS, and PEC activities across 37 countries in Africa, as shown in this map. We have a comprehensive work. Yes, please.
We are still on slide 1.
Oh my, okay, then there is a problem. Can you perhaps present from your end? Because I have been moving slides and maybe it's not moving. Shall I start again? You could project from your end, Aline. There seems to be a problem.
Okay, let me work on it.
Thank you.
I would say that you could continue, and I'll catch you. I'll catch you up.
Okay, thank you. Sorry about that. So we have a holistic approach to employee well-being, or to the APHRC Workplace Wellness Program. And to start with, our leaders are very much involved in this. This is the way they set the tone at the top by formulating policies on health and safety. So we have a safety and health policy that is guided by the Occupational Safety and Health Act in Kenya. We've had the policy since 2008 and is regularly updated. And then the leadership also participates in these activities. Other than the leadership, our employees are all involved because we share the policies with them. They give feedback on what it is that needs to be implemented. And we also share discussions on open forum, staff meetings, and during onboarding, just to talk about safety and health at the workplace. We also have other related policies that border around employee wellness, like policy on harassment, whistleblowing, and so on. We have a safety and health committee in place that consists of staff from different divisions, the 4 divisions that I mentioned at the beginning, and this has been very useful. So looking at the WHO model of workplace involvement, I'll start with the physical work environment. And Eileen, have you gotten the slides?
Not yet. Wolf, if you have them in hand, I would ask you to present.
I do not have them. I can maybe pull up from last year the finalist presentation. But I do not have the slides.
Okay, let me just do this again. Can you now see the slides?
Not yet.
Okay.
Yeah, we can see them now, but it's not in presentation mode. If you could click on the screen, on the bottom screen icon for the presentation mode, that would be great, if you can see that.
Yeah, it's on presentation mode from my side. Maybe then we can use the slides from the summit. Because on my side, it's on presentation mode.
Just, I would suggest keep going. We can see it now, so okay. Just keep going. Yeah, thank you.
All right, so I'm on the physical work environment, where we have a secure campus with very clean offices. This is our office reception. We have closed offices, open plan offices, and very good meeting rooms. We also have sitting areas, both within the offices and outside in the compound. Like at the end of every corridor, we have seats where people can, go and have brief meetings or just some coffee. This is the APHRC West African Regional Office. I have slides now. So they also have a similar workplace wellness program. And we have open grounds where we also go for physical activities. which are also very, very clean. The grounds are clean. And then we have outdoor sitting areas. We use them for different activities, coffee breaks, meetings, as well as, you know, just relaxing. This is another training or conference room. And then in terms of the physical work environment, again, we have fire suppression equipment. In one of them is what we are showing here, the fire extinguisher. And then we have boardrooms as well. Our environment is tobacco-free. We use recycled water, and all our places have consideration for persons living with disabilities. So the restrooms, we've provided ramps, both as you enter the building and in the auditorium, and we have lifts. And since March 2020, we have put in place the WHO COVID-19 guidelines. So these are properly enforced. The second area is the psychosocial environment. And in this, we really are very passionate about our employees' psychosocial well-being. And we've been holding retreats, except since the pandemic because of you know, social distancing. So these pictures are from previous retreats. Other than retreats, we also have a creche where if somebody is a nursing mother, they can go and express milk.
Lillian, we need to interrupt again.
Yes,
sorry.
please.
We're having some issues here. We're still on the same slide. Let me pull up, let's see if I can do this. The presentation you presented at the Global Awards program.
Please your email, Wolf.
Excuse me?
Please your email for the updated presentation.
Yeah, I don't have access. It's not, you know.
Oh, okay, okay.
Not at this time. One sec. Can you see it now?
Yes, I can see it.
Go ahead. Just say next slide, and I'll forward.
All right, thank you. Was saying we have staff retreats to support our psychosocial well-being as employees. And next slide, please. Where staff just go to hang out together and you know, get to know each other. This helps. And then we also had a cultureship retreat in 2019. That was the last all staff retreat we had, because in 2020 and 2021 we were not able to have retreats due to the COVID-19 guidelines. Next slide, please. Next slide, please. That's also part of the retreat. We usually conduct sports days at the office, and you know, this is all inclusive for those who are not able to engage in physical sports. As you can see from the photo, we also provide board games, and sometimes they are quite competitive, and we sometimes invite also our neighbors. By neighbors, I mean other people who have offices within the APHRC campus to join the sports. This is very good for psychosocial wellness as well as physical well-being. Next, please. That's still a sports afternoon. Before COVID, we try to have them once a quarter. Next slide, please. So we have on campus also a gym for physical fitness. And beside the gym to the right is where the creche is. And for the gym, we have some equipment there. Staff go there at their own free time to exercise. And we have also provided for, you know, the properly lawned grounds for people to go and walk and also just, you know, have some quiet time. Next, please. We celebrate our achievements, birthdays, graduations, baby showers, in many ways, both in the office and at home. We visit staff at home to celebrate their life events. And so this also really enhances our psychosocial well-being. Next slide, please. We have been conducting staff engagement and satisfaction surveys every 3 years, just to have a temperature check on how our staff feel about our programs, not just for the health and well-being, but also other programs and areas of the organization. Next, please. So in the last staff satisfaction surveys, that was 2015 and 2018, we looked at various drive areas like the vision and mission, and those were the scores. As you can see from the slide, there were improvements in all drive areas, maybe except one which had 1 percentage point less. But overall, there was improvement in staff satisfaction, and that made us know that the programs that we put in place for employee wellness making employees happy and satisfied. So there's teamwork, the colleagues, co-workers, supervision, there was improvement in those areas. Next slide, please. As you can see, the overall satisfaction has been increasing, and this is based on the 3 surveys we've conducted. In 2012, it was 53%, then it went to 62%, and you know, the last one was at 70%. We'll be conducting another survey early next year. Next slide, please. So we also have put in place an employee assistance program where staff are able to consult professional counselors on any issue that may be troubling them, both as individuals and in relation to their work, if they are not able to discuss it within the offices. And that has been very, very useful. We have happy hours sometimes, and we also support staff when they are bereaved. In addition to all this, as part of psychosocial wellness, we organize for health talks in areas such as mental well-being, financial health, vocational health, social health, and so on. Next, please. So we also have regular check-ins from unit leaders and team leaders, and we have enabling policies. For example, we have 24 days of paid time off. We call it vacation time off for staff. And we also allow staff to travel with their infants up to the time the children turn 12 months old or 1 year. Nursing moms also work less hours until their babies turn 6 months old. And this has been quite supportive to staff. Next, please. So next, we're going to talk about personal health and well-being. In terms of personal health, we have next, please. We have a health insurance cover that is fully paid by the organization, and it covers the staff and their families, including an annual checkup and vaccinations. Sometimes our health and systems for health unit arranges for blood pressure checks for staff to know their BP. And then we discourage emails after 5 p.m. and on weekends. And then we have a joggers club. This is a club where staff members voluntarily join, and you post on the WhatsApp group. It's a WhatsApp group, and you post what activities you have done during the day or over the weekend. It is self-paced. Somebody commits to their own personal goals, and as long as you post that you are able to move, it could be walking, jogging, or working around the house. We also have a football club, and they've been participating in tournaments alongside other institutions. We have a quiet room where staff can go and, just reflect. And we also have a group for urban farmers within the institution. This was started by our staff, and where people are encouraged to grow organic food on their balconies and backyards. And this has been very helpful in terms of, being physically healthy. Next, please. So on enterprise community involvement, again, this football club, other than practicing within the office. They also participate in community events, like on this day, they were at the Standard Chartered football tournament. Next, please. We also participated in, corporate social responsibility events as a response to COVID-19 pandemic, where we made donations to various communities where we work, just providing them with foodstuffs, but also other equipment for other items to prevent COVID-19, like face masks. Next, please. In addition to that, from time to time, we conduct free medical camps and sometimes give donations to schools. And we also have a fund, it's called the Jubilee Education Fund, where we identify needy students and we pay education school fees for them. Next, please. So part of the enterprise or community environment involvement, we also conduct webinars and research, not only on COVID-19 issues, but also on other health-related issues. We've been involved in school painting. We participate in marathons that are organized by other institutions. I've talked about the medical camps, clothes and food donations during various events. Next, please. Our staff also serve as reviewers of a number of scientific journals and serve on various boards. We also have staff who are called upon to give talks on TV and radio, on development issues in Africa. The non-communicable disease support to research communities has also been going on in the informal settlements where we work. And then we partnered with the Ministry of Health to launch the continent's second human milk bank in Nairobi, and we are very proud of these achievements. Next, please. There are some awards that we've received, like in 2015, the United Population Fund Award was given to us for outstanding contributions to increase the awareness of population issues and their solutions in Africa. And in 2016, we received a certificate for outstanding support for breastfeeding women at work. And multiple times, including this year, we've been recognized as a global think tank on health issues. Next, please. So in terms of evaluation and continuous improvement, we've been having incremental things, so as I mentioned, we started these programs in 2008, and, from last year, we added the crèche, and in response to the pandemic, we've not been able to go to the office, but we are providing more of the psychosocial support. Our leadership commitment is continuous through funding and also participation in all these events. For the physical environment, we maintain the offices to be clean, and we conduct maintenance checks like on the lifts, fires, and safety equipment and other equipment that are used within the offices. For psychosocial support, for evaluation and continuous improvement, we get feedback from our staff through the satisfaction surveys, but also in the open fora that we hold, the staff meetings, some send emails, and we're able to improve on that. For personal health, we continue to provide a health insurance cover, as well as to encourage staff to go for annual medical checkup. We've been working remotely from March 2020, but we encourage staff to go for annual checkups. When we are working from the office, we do bring service providers to come to work to conduct the annual checkup, so that those who are too busy to go to the provider can do it from the office. And then we get the feedback and improve on the existing programs. Next, please. And that's the Health and Safety Committee. This year, one more person was added. I think these are the slides from last year. Thank you very much. And sorry about the technical hitch.
Thank you very much, Lillian. Because we had few difficulties at the beginning, can you please, Wolf, share the first 10 slides? People would like to see the office. And Lillian, if you don't mind going through it quickly.
1 second.
Okay.
Thank you. So that's our reception, and on the right is one of the meeting rooms. Those are our staff members working there. Next slide, please. Yeah, that's the corridor to the offices, and then the sitting area at the end of the corridors. This is how our open field looks like. That is where we hold our games and staff NDR parties, very many outdoor functions. And then on the right is the restaurant. They provide good organic food, healthy food. And this is the outdoor sitting areas. Staff can use them for, personal relaxation or meetings. And then this is one of the training rooms. We have about 4 training rooms and an auditorium. Yeah, this is how the open plan, on the right is the open plan office space. On the left, this is one of the closed offices because it's the IT server room, IT managers and server room office. Next slide, please. Yeah, the other closed offices look like what is on the left-hand side, and on the right is another meeting room. We have a larger boardroom. Yes. We also have, similar offices in Senegal. It's much smaller because we have 16 staff there. The rest of the staff are based in Nairobi. Thank you.
Thank you very much, Lillian. Well done. You're doing a great job on this, and you already have a very robust program. Can you share with us how did this start? Because a lot of organizations may feel that it's a lot to take at once, but if you can share how all this starts, maybe you can motivate other organizations to do the same.
Thank you. So yeah, it started small. First, of course, it started with the physical work environment, ensuring that our offices are clean and that, people understand safety issues, fire, health, and psychosocial well-being. Also, we started with, we've always had retreats, not necessarily residential. We started small, being an NGO also, and we had fewer staff. So sometimes we have the retreats as, residential. Sometimes it's a one-day retreat. People just go and unwind. And for community environmental involvement, we conduct our research in the informal settlements, mostly within Nairobi, but also in other countries in Africa, in other areas. I must also clarify that this program is for the HQ in Nairobi and the West African Regional Office, which is based in Dakar. So for, like the food donations and clothes and free medical camps, we do those in the communities where we work. So I must say it started small, and we've been improving thanks to our staff and the leadership. Our staff have always given very good ideas for improvement, and we do listen to them. Thank you.
Fantastic. We have a question from Alberto Ogata. Is there any indicator of social determinants of health to address and monitor?
Okay. Maybe you can read the other questions so I take them together. Thanks.
Sure. And the other one is if there is any cultural initiative to help the engagement of employees.
I didn't get the second one. Kindly, Aline?
If there is any cultural initiative to help the engagement of employees.
So to have for the engagement of employees, everyone is invited to contribute, you know, like we say that if people have ideas, they are free to forward it to the committee or to HR or to management. And also during staff meetings, you know, we have sessions where we talk about operational issues or administration and health. So this is how the employees get involved. And also in the committee, we have employees from different divisions. So they bring on board ideas from other employees that they interact with. Yeah, thank you.
There is a number of aspects that have been considered essential when creating healthy workplaces. In the case of your organization specifically, what would you say was key for you to get to this point?
Say that again, please.
What would you say was key for your organization to get the success you are having with this program?
It's both leadership and staff involvement, because without leadership buy-in, it would not be possible. And also without the staff sharing ideas, but also participating, you know, in formulating the policy, but also in implementation of the programs. For example, if you talk about, you know, the physical environment, you know, people looking out and ensuring that what we say should be done is done, you know, following through our programs and policies. If we have, say, a retreat, people participating and speaking out, we have an open culture. So that's speaking out. So what is key is, you know, the leadership and staff involvement.
Okay, and has mental health of your employees deteriorated or improved over the last year?
I would say we are yet to evaluate that because what we have done is continuously encouraged people to seek support where necessary, and having regular talks. We had 1-2 months ago on mental health. Tomorrow in the afternoon, we're also having another talk on, you know, loss and grief and how to manage that, because we realize that since the pandemic, there's been a lot of mental health issues going on in the world, because people are working remotely, some people are living alone and not having people to talk to. You know, some people are also overworking, because when you're working at home, it's difficult to differentiate, you know, the me time and the office time. So you might find yourself working throughout. But the fact that we have provided the employee assistance program, and with that, we have 3 different organizations that we work with who have professional counselors. We know that our staff, the uptake has increased definitely from the bills that we receive. Because it's confidential, they would not tell us who has gone to seek what kind of support, but because we are paying more for it, then we know that people are seeking the services, which is a good thing. Thank you.
Good, very good indeed. A very specific question. Do you use WhatsApp to communicate with employees?
Yes, we use both WhatsApp and email.
Okay.
Yeah, both WhatsApp and email.
Isikilu says only 1% of employees have access to workplace wellness services in sub-Saharan Africa, mostly with multinationals and agencies like yours. What can we do to help with SMEs and informal sectors to increase access to workplace wellness programs? From your point of view, Lillian?
I think we we just need to encourage SMEs to start small. It doesn't have to be a big thing. It doesn't have to be expensive. And one of the things that has made us successful so far is the fact that not all programs have to be, monetary. You don't have to use a lot of funds. For example, it's unfortunate that the slides didn't show from my end, the updated slides. I could show you where our staff work, like at lunchtime, you find that people go walking in groups, and that helps with the psychosocial well-being, the collaboration, bonding. So it doesn't have to be expensive. And now with WhatsApp, like in the Movers Club that I was talking about, or Joggers Club, I walk from my house to maybe another location and just track the number of kilometers and post there, and people will clap for you and you feel encouraged. So we don't have to use a lot of funds. For counseling, people can have a counselor on site, but then there are disadvantages with that, because staff may feel that you'll be able to tell who went to seek counseling. So for that, perhaps they can find other ways to address it. So for me, it's to encourage SMEs to start small. It doesn't have to be expensive. Yeah. And for the leadership to be involved. Without leadership involvement, it's not easy. So leadership buy-in is very important. Thank you.
How do leadership show they buy in your case? Because we see it is one of the aspects that is crucial for programs to succeed, but then how?
So when you approach leadership, you need to explain to them how this is going to improve productivity. And remember that staff are the most important assets in the organization. So unless their well-being is looked into, they will not be productive. So if you have staff who are well, the organization will also be okay, so it's very, very important. And we also need to look at the entire, the 4 areas of well-being as stipulated by the WHO. So to get leadership buy-in it's sort of negotiation, and persuading them that, there's value in this. There's value, say, in going for a retreat. Of course, it might be expensive. And so that's why I was saying, you don't have to go and say, spend 3 days at the cost. You can go to a place half a day, unwind, you can play together. There are those who do not like playing, of course, but find small ways. And also to get staff views is very, very important, because once you have a number of staff, they have different ideas, and that will really help.
Thank you, Lillian. You mentioned that knowing that the sessions, the counseling sessions, are considered anonymous, you got more participation from employees. Apart from that, how has your organization tackled mental health stigma? And this another one associated with that? Are your employees currently talking about these issues openly? These questions are from one of our participants.
Okay, so we actually also conduct research on mental health, and apart from that, the way we address stigma is by inviting professionals to come and talk to us about mental health issues. We engage with them, we ask questions, and they clarify, and we encourage employees to view mental health or seeking psychosocial support as something that is part of being well holistically, and it doesn't mean that if I go to see a counselor or a psychiatrist that I am mad, because in Africa, really, when you talk about counseling, people think you're mad. And so people who need counseling would shy away from going. So the frequent talks help those because people ask questions and clarifications are made. And of course, if we know of any staff who is stigmatizing others, then we would take action, disciplinary action, because we do not allow discrimination or stigmatization in the office. Yeah, thank you.
Thank you, Lillian.
Was there a second part of the question?
Yes, but I guess it was covered.
Okay.
Oh, I would go for another one. Katya is asking, are there conversations with employees about integrating more health protection actions to improve work conditions in addition to health promotion?
More health protection?
Yes, protection instead of health promotion.
That's not very clear to me. Can you clarify that?
Katya, can you please elaborate on your question?
Yes,
I would say that.
Hello, everyone. I'm Katya Costa-Black. I'm just interested to know if there is health and safety conversations as part of these activities where they feel that they are able to take care of some health issues and concern in general for their wellness and well-being, but are they talking about concerns with regarding work conditions and health and safety during these activities?
Yes, thank you for that. Yes, we have conversations about health and safety. So, for example, if people are in the office and they observe that certain things are not going on well, maybe there is a drainage leaking, they will raise it and say, okay, we are concerned that this is not happening, or how come this year we've not had a fire drill, for example, you know, because we know that every year we should conduct, you know, a fire drill, and every year we also train first aiders and fire marshals so that in case there's fire or terrorism, you know, we have wardens who can help people around. So our staff do ask those questions. Some will ask openly, some will ask privately, you know, to the committee or to HR or management. So we do have those conversations, yes.
Thank you, Lillian. Are you thinking of, I'm not sure if someone was asking a question. Okay, are you thinking of offering more online wellness programs in the future? This is a question from Martin.
Online, yeah, I mean, if we do not go back to the office soon, then of course we will offer more online wellness programs. It's more difficult because you know, everyone is in their corner at home or somewhere else, wherever we are working from remotely. So it's easier when we are together, but we try to encourage one another. For example, even by posting on the WhatsApp group, and even during the coffee hangouts, maybe something I did not mention is that every month the executive director has coffee hangouts with staff. So because we are 172, we have 4 meetings, and every staff must log into one of them where there's no agenda. You just, you know, say how you're doing, and people laugh and get to know each other. Yeah, and turn on your video so people can actually also see you, because sometimes it takes a while before we meet one another. Thank you.
Sure, sure. Lillian, would you say that there are particular aspects from the African context that influence when we are creating healthy workplaces? And if so, what aspects are those?
I think like our culture, you know, is such that people like to socialize. So the African culture that really impacts this impacts more the aspect of psychosocial well-being, because in Africa we like to celebrate events, whether it's birthdays or graduations, weddings, and any reason to have a community engagement and have some celebration is always welcome. So that helps. And yeah, for the rest also, it depends on some countries, where they are used to having certain games, or like, let's say in Kenya, we have runners. So it's easy to also get people who like jogging or running and things like that. So it all depends. Yeah. Thank you.
Thank you. Wolf, I promise this is my last one. Have
No problem.
approaches at a national level influenced in any way your organization to pursue these initiatives? If there are any initiative at a national level related to this, to occupational health and safety?
Not really. I would say that we have an Occupational Safety and Health Act, which gives some guidelines on what you need to have in your health and safety policy. But beyond that, whatever else you implement is your own initiative as an institution. So for the national regulations, it's more of, you should have maybe fire extinguishers, have a lift that is serviced regularly. But beyond the for the national, they look at the physical environment, the physical work environment. The rest is more of the institution's initiative.
Understandable. Lilian Isikulu is asking for your contact on the chat, if you don't mind sharing it there. Maybe other people are also interested. And I will only, at this stage, thank you for sharing, for being open, and congratulate once again your organization and yourself for the work that you have been doing. And we hope that this inspires many other organizations that we that are here in this event can do something about it. Thank you very much. And now back to you, Wolf.
Thank you.
Thank you, Aline. And congratulations again to APHRC for being a Global Awards finalist last year. So that was a very strong showing. And Lillian presented last year to the world, basically, on the program. So it was very well received. And for us at the Global Center, that's really our mission. We'd like to, and we do, share these best practices throughout the world. We want to make sure that, yes, everybody finds out about them, can learn from them. As you know, it's not always a one-to-one. You can't replicate things necessarily, but you can learn from them and maybe try with a different strategy within your own company. And we have the likes of IBM present, but at the same time we have organizations like Lillian's present, or even smaller enterprises from wherever. So it's really exciting, and yeah, to share that on a global scale. And as I mentioned, our event is coming up again in November. In the remaining time, I did want to mention the International Association for Worksite Health Promotion. Just very quickly, the association has its roots in the United States, a long time in the 1980s. I won't go into that at this time, but it is a global association. It's really, I think, the only international association with members in our field in workplace health promotion. And we would like to further globalize. We have a strong US membership, we have a strong Brazilian membership, thanks to Alberto, but we would like to really make it grow larger. So we would be interested to hear from you. Obviously we don't have enough time now, but in the future, and maybe as a follow-up, what resources, what kind of programs, including webinars, including conferences, we can bring to professionals in Africa and wherever it is in specific countries. Obviously, the community building, the network building is huge. It's a big benefit to bounce ideas off each other. That could be on a regional basis, a country basis, but it could be all global too. You can learn from each other. We've had some excellent exchanges from students even, in different countries, which can be really helpful. So I would encourage you, in the coming weeks and months to really, to come out and give us some suggestions what we can do. I put the website address here in the chat. Take a look at that. Let us know what's kind of lacking, what you would like to see. Obviously, language can be a barrier. I know not everybody speaks English in Africa, obviously. So but we can work around that, I think. That's one aspect. There's so many more. So please do so. Again, it's a membership association. It's for practitioners who implement or manage programs. It's under the umbrella of the Global Center for Healthy Workplaces, and it's basically very new for the Global Center, but again, the association's been around for a long time. So we'd like to really improve and advance, and hopefully we can hear from you on. See, we have a member, Izikulu. Thank you very much. That's great. That our membership communications still work, so that's good. So hopefully, maybe one of the future things, and again, I'm just brainstorming here, but maybe we can have an IHP member or interested potential member session next, and it doesn't have to be, for Africa as a whole. It could be again. So keep bringing your ideas. We really like to hear them from you. And I'll pause here if there's any last comments from either Aline or Lillian, or also from Tommy, who's the co-director of the Global Center with me. So if there's anything else you want to add at this point, we have a couple more minutes left. So feel free to do so.
Hi, Wolf. I'd just like to come in if it's okay. Tommy Hutchinson, yes. Also co-director with Wolf. We have our main summit, the 9th summit, on the 17th and 18th of November. And we'd like to extend complimentary attendance participation for everyone who's attended this seminar to our main summit. So we'll be sending out notification, and please register for the summit itself, and it will be complimentary to everyone who's attending this one.
Great. Thank you, Tommy. I just featured put the web address in there, the link for you to take a look at. And as I said earlier, just send us an email on that address, and let us know if you're interested in participating in the Global Summit, and we'll get you some access. We'll get you access. So I think we're at the end. Special thanks again to Aline for moderating. You did a great job. Thanks so much. And Lillian, as always, great program. Keep doing the good work you're doing in Kenya, and hopefully we can learn from it further. So thanks everybody for joining, and I'll hopefully hear from you and talk to you soon. Bye bye. Talk soon.
Thank you.
Thank you.
Thank you.
Thank you.